We welcome you to our module Vascular Disease, Peripheral Artery Disease, HCC 108 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of peripheral artery disease. At the end of this module, the learner will be able to describe peripheral artery disease along with its causes and symptoms, discuss the criteria for the documentation of the disease, identify the ICD-10 codes that fall under peripheral artery disease, review the example of the assessment and plan for the disease, note the exceptions involved in the coding of peripheral artery disease. Peripheral artery disease, or PAD, is the narrowing of the arteries in the peripheral body circulation outside the great vessels of the body. The term peripheral vascular disease, PVD, is also used to refer to peripheral artery disease in some cases. A buildup of fatty deposits causes the arteries to narrow down, thus restricting the blood flow to the arms, kidneys, stomach and other parts of the body. It can be treated as an indication of atherosclerosis. The most common symptoms of peripheral artery disease include claudication, numbness in legs, sores in the lower limbs, weak pulse in the legs and feet, or even erectile dysfunction in case of men. In the progressive stage, the pain is persistent and is present even when a person is sitting in a dormant position. While coding for peripheral artery disease, special attention should be paid when mentioning the type of vessels. Confusion with venous diseases like varicose veins should be avoided. The criteria for the documentation of peripheral artery disease includes a physical examination and, or ABI, TBI and duplex US. The physical examination measures diminished or absent pedal pulse and is the best way to support the diagnosis of PAD, but not for the definitive diagnosis. ABI or ankle brachial index, on the other hand, is the ratio of the blood pressure at the ankle to the blood pressure of the upper arm. It is best recommended to establish the diagnosis. Resting ABI results should be reported as abnormal, ABI less than 0.90, borderline, ABI 0.91 to 0.99, normal, 1.00 to 1.40, or non-compressible, ABI greater than 1.40. TBI refers to the ratio of the blood pressure at the toe to the blood pressure of the upper arm, and duplex ultrasound test is done to see how the blood moves through the arteries and veins. The ICD code for peripheral vascular disease is I73.9 and the HCC is 108. The assessment and plan should address the diagnosis as current and include two support indicators. Let's see an example of a progress note for atrial fibrillation. Patient name: Brian Coleman. Date of service: October 26, 2017. Date of birth: September 28, 1965. Assessment and plan: peripheral arterial disease, I73.9. Improving. No symptoms. Continue aspirin 81 mg qd. Avoid alcohol and smoking. Control of risk factors. Exercise as tolerated. Walking. I talked to the patient about increasing the distance of walking. Exception: while coding for PAD, keep in mind that it is closely related to lower extremities of atherosclerosis. They are related but not the same disease, hence they cannot be coded as the same. Atherosclerosis is the beginning of peripheral artery disease and still might be reversible in the earlier stages. We have reached the end of our short refresher course on vascular disease, peripheral arterial disease. We gave you a short introduction to the disease, reviewed the criteria for its documentation, discussed the assessment and plan for PAD, and finally noted the exceptions when it comes to the coding of peripheral artery disease. Thank you for joining us.